It's April. It's Oral Cancer Awareness Month. What is the dental assistant's role?
Dental assistants should be trained to perform both the extraoral and the intraoral cancer screening. That alone will elevate the identity of the assistant in the eyes of the patients.
What if I find something? And should we be nervous about that?
Early detection saves lives. So
Really?
if this is anything to be concerned about, we'll just nip it in the bud and everything will be fine. We need to train dental assistants and give them more autonomy with hands-on patient care. There's so much more that assistants can do if we just take the time to train them, give them the verbiage and the technical skills, and let them go. Everybody on the team should rise up and be more and more professional to move our practices forward.
And it can be a life-saving thing to let them go and do that.
Your heart and your gentle, loving care is a big part of the reason that we can get through the treatment that we provide.
Dental assistants need to hear this. Dental assistants are often the key to a patient accepting treatment or not. You're a key part of the patient journey, and so is Care Credit, a health and wellness credit card with flexible financing options so patients can pay over time for care they want or need, subject to credit approval. Want to know how to make sure Care Credit is a part of your practice's offerings? Email me at kevin@kevinspeaksdental.com and I'll make sure to help. That's kevin@kevinspeaksdental.com to make sure Care Credit is a part of your practice's offerings. Hey everyone, it is Kevin Henry, founder of Dental Assistant Nation and editor-in-chief for drbicuspid.com. Welcome back to another episode. I am thrilled to welcome in somebody I've known for a long time and somebody that I respect deeply in the dental industry, and that's Kathryn Gilliam. Kathryn, how are you, my friend?
I'm great, Kevin. Thank you so much for having me here. I'm excited to be here.
You reached out to me and said, we need to do this. And so I always love when people do that, and especially the topic we're going to talk about today. But before we dive into that, I'd love for us just a little bit more about you.
Okay. What's so bizarre to me still is that I've been a dental hygienist for 40 years.
That's not possible.
Wrap my head around that. Yes, I was 5 when I started.
There you go.
That's my story. But 40 wonderful years. I love being a dental hygienist. I have been a coach and speaker for 26 years. So that has been super, super satisfying. And what has been occurring to me as I go into client offices is that dental assistants are left out of the whole conversation. It's driving me crazy. Now, when we work with Inspired Hygiene and with my own coaching company with teams, we spend the first day with the dental hygienist and the second day with everybody on the team because we need the whole team to understand the message of patient health and whole health. So very often it's the assistants who will say, the people who work on the business team, they understand that they have to do the scheduling and they have to understand how to code properly and charge the fees and do all of that treatment presentation. They get why they need to be there. But the assistants consistently say, Kathryn, why do I have to be there? Like, you have no idea how important you are.
Yeah.
And it breaks my heart. And I know how you feel about it too.
Yeah, it does me too. And I will tell you, it did me good for you to reach out and say dental assistants need to hear this, and for you just to say that, because I think the more the dental assistants understand from so many people how important they are and recognize that they're often overlooked in things, I think that moves our industry forward. So thank you for saying that. I appreciate it.
Of course. I truly believe that we need to train dental assistants and give them more autonomy with hands-on patient care. Train very intentionally and help them understand how much more they could be doing for patient health. And once they have that training and that understanding, they become really professional dental assistants. And that's what we want. Like, everybody on the team should rise up and be more and more professional to move our practices forward to achieve higher levels of patient health. I just see great things happening when we lift up our assistants.
A rising tide lifts all boats. I believe that completely. And,
Yes.
the one thing that I know you and I talked about a little bit before on email and then before we got on today was, it's April. it's Oral Cancer Awareness Month. I personally believe, just like Dental Assistant Recognition Week, every month should be recognizing this, and the battle against oral cancer. What is the dental assistant's role whenever it comes to head and neck cancers, whenever it comes to things that may not always be the most pleasant to talk about in the practice, but yet are so important to dental patients?
I think that dental assistants should be trained to perform both the extraoral and the intraoral cancer screening. There's no reason that they can't do that. And I believe that would be a fabulous use of their time for every patient at every appointment in which that patient is being anesthetized. As they're waiting for the anesthesia to take place, they can do this exam. My version of it is about 3 minutes. If we add fluorescence, maybe it's 5 minutes. It can be done during that time frame. That alone will elevate the identity of the assistant in the eyes of the patients. Just having them understand and know the verbiage that goes along with that. And that's one of the things that I train. And in fact, I just posted on social media last week about a situation where I was training the team and we found a thyroid cancer in one of the hygienists. That is not the first time. We are finding cancers in dental professionals. We all need to be checking one another, everyone on our team. And I'd like to see those assistants get hands-on with the patients and do those screenings because very often they're working with patients that we're not seeing in hygiene. So they could be finding these abnormalities and pointing them out to the dentist. They can be screening for inflammation, broaden that topic even more. They could be doing pH testing. Simple testing. There's no reason they can't check pH levels, and then they would know they need to have a conversation with the patient about dental caries risk. So another great use of their time. They can make microscope slides if they're fortunate enough to have a microscope and educate the patient on their level of inflammation, and that helps motivate patients as well. They can be doing microbial testing. It depends on the State Practice Act, but
Right.
there's so much more that assistants can do if we just take the time to train them, give them the verbiage and the technical skills, and let them go.
Amen. And it can be a life-saving thing to let them go and do that. I want to say real quick before I ask you another question that dental assistants, as you've heard me say numerous times on here, and I want to make sure you hear this as well, know what you can legally do in your state. It's important not only to protect yourself, but also to see what opportunities there are for career growth. And I strongly encourage you, Dental Assisting National Board, danb.org, click on Meet State Requirements, and there's a list of every state on there and what you legally can do in that state. Critical information. And Kathryn, I've got to ask you a question because I fully believe what you're saying. And I fully believe dental assistants should be doing more in the practice. My question is, how do we tell the dentist that I'm ready to help out with these exams? I'm ready to do these types of things. What kind of verbiage do you suggest that they talk to their dentist to say these things?
I really like to coach my assistants to say something like, very similar to what you said, I'm ready to grow, and I'd like to grow right here with you and with this practice. So a little bit of reassurance that, no, I'm not going off to dental school. I want to grow in this profession because it's a very important profession. And also, they should talk about the fact that just because so much of what they do is not noticed doesn't mean it's simple.
Mm.
So we are seeing them, or actually not seeing them, do so many things. They're managing inventory. Rooms are clean, instruments are sterile, supplies are available. All of these things happen. We've got plenty of nitrous in the tanks. Why? Because somebody who's very organized is managing all of those systems. And we're not noticing it because it's seamless. We just know we're feeling very supported as clinicians, right? Well,
Right.
how is that happening? They should point that out. I'm managing all of these things, and I'm capable of so much more, and I want so much more. I
I
think
love
too.
that.
Yes,
I do.
me too. I think that we should value the humanity that they bring to our teams as well. Because when we walk into a room and our patient is calm and prepared, that doesn't happen automatically. That happens with an assistant taking the time to interpret what the dentist has told the patient. And maybe the patient waited till the dentist left the room to say, what is she talking about? What does that really mean? And so there's so much to be said for the interpretation and the explanation and the education and the hand holding that people need sometimes to get through the treatment that they need. I place very high value on that, and I think it's often overlooked. So, dental assistants, if you're listening to this, if you're taking notes, make sure you bring that up because your heart and your gentle, loving care is a big part of the reason that we can get through the treatment that we provide.
So I've got to ask you a question, and I have heard this from dental assistants, okay? It is, what if I find something? What if during that, as you mentioned, that hygienist who found the thyroid cancer, what happens, and should we be nervous about that, I guess is a good question to ask you.
Right. So, what I've learned, it's taken me some time over my career to learn that I have to be very professional and project a calm demeanor to my patients, even if I'm nervous inside. And
Mhm.
one of the things that makes me nervous is when I find something. So, I
Sure.
totally understand that question. And the way you do is you take a deep breath and swallow, and you say, there's just something here I want the doctor to take a look at, make sure that everything's okay. In a very calm, cool voice, doctor comes in, doctor, I just noticed something here. Would you please take a look? Tell the doctor where it is, let the doctor look, and make sure that the patients understand it's important to come back. If we're talking about a lesion, for example, that could potentially be malignant, they need to come back. So we're going to actually make their appointment in no more than 2 weeks. We're never going to say, if this spot is still here, I want to see you in 2 weeks, because they can't see what we see.
Right.
And human nature is such that they don't want to come back. They don't want to think about it because it's scary. Just say, I'm going to make this appointment for you because I care. And most likely, this spot will be gone. If it's, a cheek bite, if it's a burn, whatever it is, most likely it'll be gone. We'll see you for 5 minutes and you can go on your way. But if it is something concerning, we need to have it biopsied right away
Mhm.
because what we know is that early detection saves lives. So if
Absolutely.
this is anything to be concerned about, we'll just nip it in the bud and everything will be fine. So lots of reassurance, but firmness that that patient must come back.
There was a time, I think, whenever dental assistants did the health history form and they looked it over and they saw, okay, this person's a smoker, so I really need to be cognizant. But I will tell you, I've had a friend who's gone through oral cancer, never
Mhm.
smoked, never dipped, never did anything like that, and still had oral cancer, and it's been a horrific journey for him. And I think it's important, and correct me if I'm wrong, that we don't think about it because there may not be any warning signs on the health history form.
Absolutely right. I'm so glad you brought that up. So many of our patients have never used tobacco, don't have any of the risk factors. But that's why we check every patient every time. And it's such a simple, quick screening that it's not cumbersome for us to add to our appointments. But the fact is that with HPV, especially, that's not something that we can just know about somebody. It's not typically on our health history forms. We're not screening for it. We do have tests for it, but most practices are not screening. So we have to almost forget about who's at risk
Mhm.
because it was middle aged Caucasian men. And now it's younger and younger people, it's women as well, it's girls, it's children. We're finding this cancer in everybody across the board. And 70% of the time, we're finding it in the neck instead of in the mouth. So
Right.
that's why that extraoral exam is so important. And that's what I teach. And that's where we found the cancer on one of our hygienists. It was in her neck. And thankfully, that was early detection, and she's well now.
Good. Good to
2
hear.
years ago, it was a hygienist who we found it late, and we lost her. And I just when we start thinking about our patients, so many of us have really close relationships with our team members and our patients. We don't wanna lose anybody. So let's find it early, and let's not think about who is at risk and if they're just smokers. Everybody's at risk.
I love that, and I think that's such an important point to take away from this, and I wanna ask you one more thing before we wrap up. I know that so many dental offices are busy, and, I know you said about 3 minutes for what you teach. Do we have time for 3 minutes in the practice, and how do we make sure we have time for those 3 minutes?
My answer to that is always what could be more important than saving a life? That's the priority. So for me, I will do that before I'll do anything else. If I have to bring somebody back to do a prophy, then I'm going to bring them back. It really doesn't happen very often that head and neck exam is what caused me to not have time to do something else because, like I said, it is quick and easy. What it really comes down to is what I call fit chat versus chit chat. So during
Good.
that time that we're talking to our patient and we're not actually working, Typically, during anesthesia time, if the room is prepared and ready ahead of time, very often we'll see the assistant chatting with the patient. Well, that chatting time is important, answering questions and calming people down. And also, that can be done while doing the cancer screening.
We can always ask how the weather is while doing that as well, right? And the other
Right.
important questions we asked while trying to kill some time in the practice.
That's
Uh,
right. That's right.
Kathryn, I so appreciate you coming on to give these tips for our dental assistants and to remind us all during Oral Cancer Awareness Month how important the work is that's being done in the dental practice to save lives. If somebody wants to reach out to you, learn more, ask a question, what's a good way to get a hold of you?
I hope they do.
I
They
hope so
can
too.
reach out to me at Kathryn@inspiredhygiene.com. I'm happy to answer questions. I'm happy to connect people if you need specialists or whatever I can do to help. I'm happy to teach head and neck cancer screening and support assistance in any way I can.
And we're going to put Kathryn's email in the show notes, so very easy for you to find. And we're going to make sure that you can get connected if there's a question you've got about either what happens if I find something or just how to make sure it's actually done in your practice because it's so important. I think we all know somebody who's battled this battle, and for each of them, we should be doing our best to make sure that we're doing it every day in the practice. So, Kathryn, it's great to
Absolutely.
see you. Thanks for taking the time to talk to the dental assistants and share your passion. I appreciate it.
Thank you, Kevin. I appreciate it.
Absolutely. And hey, thanks to all of you for listening to this episode of the Dental Assistant Nation podcast. Again, it's April. It's Oral Cancer Awareness Month, but it should be 12 months out of the year. This should be a battle that goes on every day in the practice and something that we take those 3, 5 minutes, whatever it is, to make sure that our patients are safe and can live a long and healthy life. Till next time, it's Kevin Henry, founder of Dental Assistant Nation, thanking you for joining us, thanking Care Credit for their sponsorship of this podcast. And as always, wishing you nothing but success ahead.